Low sperm count, medically known as oligospermia, is one of the most common causes of male infertility. It refers to a situation where the sperm count falls below the normal threshold, typically defined as fewer than 15 million sperm per milliliter of semen. Medical causes of low sperm count include infections that can interfere with sperm production. Examples include sexually transmitted infections, inflammation of the prostate, also known as prostatitis, or inflammation in other reproductive organs. Conditions affecting the hypothalamus, pituitary gland, or testicles can result in hormonal issues that reduce sperm production. Genetic conditions like Klinefelter syndrome, Y chromosome microdeletions, or cystic fibrosis can affect sperm production. Varicocele, a swelling of the veins that drain the testicle, can lead to reduced sperm production. Retrograde ejaculation that occurs when semen enters the bladder instead of exiting through the penis during ejaculation. Both malignant and benign tumors in the reproductive organs can affect hormone levels and sperm production. A condition in which one or both testicles fail to descend from the abdomen into the scrotum during fetal development can cause infertility. Celiac disease, an autoimmune disorder, can affect male fertility, though fertility may improve after adopting a gluten-free diet. Environmental causes of low sperm count include exposure to toxins. Chemicals such as industrial pollutants, pesticides, or heavy metals can affect sperm production. Prolonged exposure to radiation or X-rays may also be a factor. Excessive heat to the testicles, such as from saunas, hot tubs, or tight clothing, can impair sperm production. Cancer treatments, especially radiation and chemotherapy, can reduce or halt sperm production. Lifestyle causes of low sperm count include drug use. Anabolic steroids, marijuana, cocaine, and other recreational drugs can reduce sperm count and function. Excessive drinking can lower testosterone levels, leading to decreased sperm production. Smoking is linked to reduced sperm count and poorer sperm quality. Being overweight or obese can affect hormone levels, potentially reducing sperm production. Chronic stress can interfere with hormones needed to produce sperm. A poor diet lacking in essential nutrients like zinc, selenium, and folic acid can impact sperm quality and count. Lack of exercise or excessive exercise can affect hormonal balance and sperm production. Over-exercising, particularly with performance-enhancing drugs, may lower sperm count. Certain medications can impair sperm production, including antibiotics that can interfere with sperm production temporarily. Antidepressants, such as SSRIs, can reduce sperm count or affect motility. And that's all for this video. If you find this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.